So Botox is a fantastic drug. So it is a neurotoxin, which I don't want it to scare you, but it's the most potent muscle relaxant on the planet. However, it only works in 1 centimeter radius. So it means that when you place the Botox, say in the jaw muscles or in the forehead, it's only going to relax those muscles. And if it gets into the bloodstream or anything like that, it doesn't matter. It's not going to do anything. So once you've had a consultation with myself, that consultation will consist of you guys coming in, you'll see me, we'll then assess your face, and then you'll let me know what you find you'd like to change the most. A lot of the time it's kind of the lines between your eyes, or maybe it's the lines on your forehead, or perhaps it's the lines kind of around your eyes. And then we can relax those muscles. The Botox usually lasts for around about 3 months. So for that time, those muscles will be completely relaxed. Really common question that people ask me is, I don't want to be completely frozen. So what we usually do is after your consultation, you'll then decide what you want to do, whether you want kind of that really frozen look or whether you want to still have some muscle activity. And then when you come in the next time, what we'll do is we'll place the Botox, and then 2 weeks later, we'll then have a review. At that review, we'll then be able to assess exactly how your muscles are moving, and then I can always do little tweaks if you wanted a little bit more. But I usually, for the very first appointment, just stick to less, and then we can build on from there. So Botox is, it's a fantastic instrument that we can use, and Botox is really for anybody, I'd say, over 20. It's really good to reduce lines once they're there, once you get into your 30s and 40s, but also in your 20s, you'll find that it helps as a preventative measure to prevent you getting lines. But I have patients in their 20s, 30s, 40s, 50s, 60s that come to see me, and that's for Botox, and mainly in the 3 areas. One of the most common people that I do get is people that want Botox in their upper tracts because they're working and they're getting quite a lot of tension in their upper tracts. Or sometimes as well when patients come in and they're grinding a lot. And what can happen is when you're grinding a lot, most of the time due to stress, what will happen is you'll grind, these muscles will get really, really active. They can get quite big and they can also get quite achy. So what we can do is we can place Botox into the muscles, which just switches them off. And then it means that you're not going to get those headaches, grind and clench as much at night. So that's a really good thing to do. And then with the Botox in the jaw muscles, that's not something that will affect eating or anything like that. It only affects, it will really switch off about 75% of the muscle. And then it means that when you're asleep, you're not going to be able to activate it as much. But then during the day, you won't really notice that you've had it done. A lot of women like it too, because what it does is if you've got large masses here, so large jaw muscles, it can just help to slender the face as well, because those muscles will go down. So the pricing for Botox is $295 for the 3 areas, and we also do the master Botox for $295 as well, just into these muscles, which is great. It used to be $495, so you guys are getting a steal.